do you incorporate the Adventist, the whole Adventist idea with your patients?
Yes, that's a very good question. Well, first thing we have to understand is that the word doctor itself, coming from the Latin word docere, means a teacher. And so as a physician, we have to be more than just, in the traditional sense, healers of disease, if you will, but also educators of our patients. And what I find to do is that most of the time when patients come to me, they have acute situations that need to be addressed acutely. And in this case, you know, we have to treat them in a medical fashion. But at the same time, what we do is we teach them that, as the Bible says, that the body is fearfully and wonderfully made. And God has put in us, in our bodies that is, the principle of self-healing, self-replication. And what happens is that if we would just return to the right path, if you will, the body the majority of the times will bring itself back to its own equilibrium. And so what we do as physicians is we treat the acute situation now, the emergent situation now, and at the same time we begin to educate our patients about, you know, what went wrong, where did we deviate from the pathway, correct those errors, and in time we see that the medications that were so needful in the acute case become less needful, with the goal, of course, of alleviating and eliminating medications.
Well, Dr. Ryan, that is very much against what we see a lot in medicine. I've got patients who come into me and they've been on a medicine for the ulcers for the last 10 months or sometimes for years. What are we doing in medicine? Are we getting further and further away from the Adventist style and more into sort of chemical dependency?
Well, I think that, again, not to overquote, but you know, the scriptures teach us in Hosea 4:6 that my people are destroyed for lack of knowledge. And to be sure, disease processes are multifactorial. Oftentimes in traditional medicine, we approach disease from only one or two factors, and so our treatment of the disease only addresses, for the most part, a lot of the symptomologies, not necessarily attacking the root. And so oftentimes those patients that have had ulcers for numbers of years, we ask ourselves, why? Why is this the case? What is the root of this? What is the lifestyle issues? And again, not to say that every single disease is brought about by lifestyles, but again, we see in the explosion of, a lot of gastrointestinal problems, we see in metabolic issues, we see in cardiac issues, we see this explosion in the last 50 years as a direct consequence to lifestyle. And so what happens is we see these things propagated from generation to generation, not necessarily because of the genetics, but we see a continuance from generation to generation of the same habits. And so what happens is we have seen in our ministry, we've seen that even in generational diseases like ulcers, like high blood pressures, that when the conditions that cause these things are eliminated, in due time, but surely in due time, the actual underlying pathology corrects itself.
But I work alongside the nurses, and I like to have a hands-on approach. So I use opportunities whenever they present themselves to teach, to find out what medication a patient is taking, and to teach them about that medication, find out why they're taking the medication, and teach them what they can do to maybe halt the need or decrease the need for the types of medication they're taking. Not going against the physician in any way at all, because we always want them to consult with the physician, but to start inculcating good habits, good eating habits, exercising, resting. There are just so many little things that we can do on the front end that would pay dividends on the back end. there's so much we can save on the front end by doing the things that we're supposed to do, doing the right things, eating right, exercising, getting adequate sleep. I mean, most of us are guilty of not getting adequate rest, but the body heals itself when we rest. So if we do these preventative things on the front end, we wouldn't have to worry about all those things on the back end. We save that money, we spend some money on the front end taking good care for ourselves and planning good habits, developing good habits, and then on the back end, we will not be paying for the medication and the hospitalization and all the things that we see in today's age.